personal safety and security of health workers and patients remains unaddressed, particularly for those working in the public sector. The South African Medical Association says it continuously hears of attacks, and in the most recent incident, the Stellenbosch Hospital has been accused of negligence after a 15-year-old patient was allegedly raped by another patient. The incident reportedly happened on Monday. The association says it knows what needs to be done. Let's find out more from Dr. Angelique Coetzee, SAMA's chairperson. Angelique, I would normally call you Dr. Coetzee, but you said in the break I should call you Angelique, so thank you. I hear stories from doctors on the front line, especially in casualty, where there are a lot of psychiatric patients coming in who are extremely abusive and doing things such as ripping off their PPE and spitting in their faces.
Good morning. Yes, you are so right. It is a huge problem, and there need to be better control at casualty level. We are asking for security gates to be put in. We are asking for the casualties in the hospital administration to make sure that it's only the patient and maybe one more person accompanying the patient that must enter the building. So because the more people there are, the more difficult it becomes to also control violent behavior. Then we need to have a screening method where you look at your patients coming in. If it's an unstable patient, if it's a psychiatric patient, you need to either immediately look after that patient, get them in and get them out, and if you need to admit them, do it as quickly as possible. Problem is with a psychiatric patient, there's not a lot that you can do because most of the times they're not in full control of what they are doing. And we have to be trained as well. And I think this is another level or lack of training on how to deal with these type of patients. Because the more violent you are against that patient, the worse you're going to make the situation. So it should be identification of such a patient, get them in, get them out. Don't get a lot of people into the casualties. It's a patient, one more patient. Get your security gates, especially in the casualties. It's a huge problem in the casualties. Cameras is not really going to assist because you need someone 24 hours to observe. And again, if you don't have also trained security personnel on how to deal with aggressive patients, now we're talking about intoxicated patients or psychiatric, that type of patient, it becomes extremely difficult because violence on violence is not going to help us.
Angelique, who are you speaking to in order to get some kind of action taken to protect your staff?
So we have spoken so far to the Northern Cape Department of Health. We have also indicated to National Department of Health that we again need to look at this. But most of the times this is lying at provincial level and not so much at national level. And there must be enough monies made available to these hospitals for security reason. If we, last week we had a meeting with the Northern Cape, and it's clear that the budget constraints are a huge problem. But again, you can get around budgets if you train. You train your security people, and you train your nursing staff, and you train your doctor what to do in these circumstances, and you block them at the gate. And you only, as I've said, allow the patient and maybe one more to accompany the patient into it, regardless whether it's psychiatric patients or not. It's not only psychiatric patients that's a problem. We also see gang-related stuff. So the one gang shot another gang member, come into the casualty, and while the doctor treats them, the other gangs come in, get entrance into the casualty, and then again, there's violent actions going in, and in the middle of that is the nursing staff, the doctor, and other patients. So we need to be strict, and there need to be some way of monitoring a metal type of detector, so that you cannot take weapons into any form of weapons, especially in the casualty, because that's the most vulnerable area in your hospital.
Angelique, just while I've got you on the line, you're also calling for health workers to receive a J&J booster shot before the fourth wave hits, and time is running out. What have you heard in terms of feedback from government?
So government is now looking at this. We know that Prof. Glenda Gray, through the Ensemble study, is also working in getting the vaccines again back for under the Sesonke, so that we can do a booster follow up on these doctors and healthcare workers that wants to have that. It's already approved by SAPRA. So in the background, this is moving. And I think if we go forward within the next week or two, hopefully we will have the green light. We're actually waiting for the minister to give us the green light and say, yes, you can carry on. We know that there is money also involved in this. And currently there is a lack of not enough Johnson & Johnson vaccines in the country. But again, if we can under the Sesonke, as we have done right in the beginning of the year, we have nearly vaccinated between 500,000 and 700,000 people. I think that should be happening again. So for now, we're talking about healthcare workers, because your healthcare workers are your frontline workers. If you get your doctors that's getting sick, or your nurses, the question then arises, who's going to look after the patients once if you get sick? And we know that the booster shot after 6 months provided a 12-fold increase in antibodies, and it's great. We need that.
All right. Thank you so much. You're always very generous with your time, Dr. Angelique Coetzee of the South African Medical Association.